When it comes to protecting our kids, plastics should not be a part of that story. Today's guest is someone who's rewriting the story of children's health, one stainless steel plate at a time. Dr. Manasa Mantravadi is a board-certified pediatrician, public health advocate, and the founder and CEO of Ahimsa, the world's first colorful stainless steel dinnerware company for kids. When the American Academy of Pediatrics released research linking plastic foodware to hormone disruption and health risks in children, Manasa didn't just take note. She took action. Since launching Ahimsa in 2019, she's turned a quiet idea into a national movement, partnering with schools, corporations, and the Clinton Global Initiative to replace plastic in cafeterias with safer, sustainable steel. Her work has been featured in Fast Company, The Today Show, and Inc.'s Female Founders 250 list, and she's proving that the connection between sustainability and health starts at the table. Manasa, welcome to Unbottled.
Thanks so much for having me.
And it's so nice to have you also here in the Midwest and, reinforcing, that we're building the future of so many of these core industries.
That's right. That's right. The Midwest can be green.
Yes.
That's
You're
right.
here. So let's start from the beginning with your career as a pediatrician, not as a product designer. So how did a plate become your life's work?
So it's interesting, right? Because food really is the start of health. And I think intrinsically, I always knew that. Grew up that way. It was prioritized in my family. When I had my own children, it became a priority in my family. And so food has kind of been the center of my life in addition to, health. And so my story actually started, I was just, going on with my life, being a pediatrician, trained right here at Northwestern in Chicago, and treating children for lots of chronic diseases, right? And so what we were seeing is just an incremental rise in type 2 diabetes and morbid obesity, early puberty, all of these conditions we hadn't seen even from the time I was in med school. So there was a big change in what we kind of saw. But again, I was going on in the treatment realm because that's kind of how we were trained. And then I had kids, and again, always prioritizing their health and the food that I was serving for them, and really prioritize, healthy, fresh food. And then one day, my mother came into my kitchen and said, What are these plastic bowls you're feeding my grandkids out of? Like, what are you doing? And I remember I went to my clinic one day. She came to watch them. I went to clinic to go see endocrine patients, like treating all of these children. I came home. All of my dishes were gone. All the cute little plastic dishes that I had gone to, the big box stores. And that was all I could choose from when my kids were starting solids. And my mom was like, I have gotten rid of all of it. It's like, why? She's like, well, there's chemicals in there. Definitely. I don't want you to put that on my grandkids' plate.
Yeah.
So I'm going to replace it with everything that you grew up on, our Indian stainless steel. And so I transitioned when my kids were very young to stainless steel, just like I grew up in, because it's very, very common in India to eat off of steel.
Yep.
And then 5 years later, the American Academy of Pediatrics formally came out with the policy statement proving my mother correct, saying the chemicals in plastic are actually very harmful to children's health. And that's how the story started, because I really felt like here we had science saying that there was something wrong and making recommendations to avoid plastic and use glass or stainless steel. But then what's a mom to do? You go into the big box store and the baby bottles and the dishes and the toys, everything's plastic.
Yep.
So there was a disconnect between what science was saying and industry was offering. So I thought, well, why don't I just help fix that? Lo and behold, I did not know what entrepreneurship was going to be like or any of the next steps to it. But that's kind of how my story started and transitioned from kind of being a clinical pediatrician to a more preventative pediatrician.
Interesting. Yeah. It's fascinating that you were thinking about that preventative approach or started thinking about that. Did you have a moment where you also realized that this was a broader public health issue?
Yeah. So, because I had trained in pediatrics and trained in endocrinology, what I was seeing is, not just one patient, but masses of patients really just looking different, acting different, in terms of their health outcomes. These children were really coming on with adult onset diseases. And here we are trying to counsel them on, eat healthy food. And it's like, what does that really mean? And so there was 2 moments in my life that it really became apparent that there was a bigger initiative here. And that's how we've always tied Ahimsa, the company I started. One was I was an intern right here in Chicago, and we had our residency clinic. And I had a 9-year-old show up. I was an intern, brand new, fresh doctor, morbid obesity, type 2 diabetes. And so I'm just all eager thinking, I'm going to help this patient with diet and exercise. And then I started really digging into what that meant for this child and this mother. They didn't have access to a grocery store. They lived in a food desert. They didn't have any access to safe places for that child to even be outside, to have any sort of physical exercise, let alone a YMCA membership or anything for her to be physically active. And that's, I think, the first inkling that I really realized that our system is designed to kind of put some of the most underserved children already behind in terms of health because of their lack of access to fresh, healthy food. And so that had kind of stuck with me. So when this AAP policy came out, American Academy of Pediatrics, really talking about food additives in our food system and how it was impacting children's health, it was an aha moment. It's not just that they don't have access to food. They have food that's really more food product, not real food. Almost 70% of what children are eating today are ultra processed food. So those are food products that are packaged in plastic, exposure to plastic, lots of food dyes, lots of ultra processed chemicals that are synthetic and not supposed to be in our bodies. So it's not that the children were doing anything wrong and choosing the Cheetos, but if all you can eat in your area and afford is a bag of Cheetos that's also laced with all these additives, it was inherently changing the way our children looked. So I realized very quickly that I had an opportunity, not just by selling a stainless steel plate, which is the product I designed, but also how do we educate and empower families in this country to recognize food as health from what, tray they're serving to the food they're serving on that tray.
Yeah, that's a heavy insight, heavy load to, I can understand why once you came across that realization, it was, you couldn't turn back almost from this mission that presented itself to you.
I couldn't because, I went into pediatrics to advocate for children. And, half my job as a pediatrician is to treat children when they're sick. And I think when a person thinks of a doctor in America, you go to them when you're sick. But the other half of a pediatrician or any doctor's job is far more important, is to keep you healthy in the first place.
Yep.
And we are really living in an American healthcare system that's designed for treatment. And again, this is not your doctor's fault. This is not, the blame. It is truly how we're trained and the system that we live in. And so really understanding that, hey, I'm a pediatrician. I'm supposed to advocate for these kids, and they don't have a voice. They can't vote. They don't have any purchasing power, right? And so how can we advocate for them? And that's like, this is my way of doing preventative pediatrics and giving them a voice, because they don't get to choose what shows up on their family dining table. They don't get to choose what's served in their school lunch. And so if I can speak up on their behalf, sure, with a product and a solution, Ahimsa, which is a line of stainless steel dishes for home and for kids and for schools, but also, a platform to really discuss food as health for them. I couldn't look away. I couldn't look away from these patients who had no option and no choice in the conditions they were getting. And that's just not fair.
No, absolutely. Now I'm feeling all riled up and passionate about this.
Yeah.
Yeah. And with Kadeya, I really relate to the insight that when you get a product, whether it's your school lunch or a packaged beverage, you're choosing the product, right? Like, I want the beverage.
Yes.
Not the plastic container.
Correct.
That's not what I'm going out to buy. And so it's really interesting how you're realizing, it sounds like early on realizing, okay, wait a second. Yes, I want to provide great food and make sure that these kids have access to healthy food, but let's also talk about like the delivery mechanism for that food.
That's right, because we often think about food as food, right? And so I think one of the major differences between if you look at the American food system and European food system, we really talk about kind of the chemicals that are within our food system. That's everything from the food itself, so the additives like the dyes and all the synthetics and the pesticides. But apart from the food, how is the food being served? It's like, why you go to the grocery store, it's like, why are my bell peppers in plastic? And like,
Totally.
why are they in plastic?
Yeah.
Like, or, the foodware. It's like, these top chefs around the world, they're making these fresh ingredients and farm to table, and then they're prepping them and storing them in plastic containers.
Right.
Or you might serve it in material that now is leaching into that fresh, organic, healthy food you just prepared.
Right.
So I think the realization of not just food, but our food system is an important thing. So from the water to the vessel that water is in, it's our responsibility to think about the food system as a vessel for health, but also for environmental health and our planet. And I think people don't think through, and by no fault of their own, on how those things are all really connected.
Yeah, absolutely. So digging in a little bit in the scientific work that you're familiar with and that you're doing. So Fast Company profiled you as part of the 2025 World Changing Ideas. In the article, they mention that findings published earlier this year found microplastics in human blood in nearly 80% of the people tested. You mentioned that the use of plastic foodware in schools, is particularly concerning. And you cite research from the Endocrine Society that shows endocrine-disrupting chemicals found in some plastics that can cause neurological impairments in children. So a lot of big concepts in there that maybe we should break down. Yes. So first, at the high level, can you share what does the science say and why is plastic foodware particularly harmful for children?
Okay, so in general, I think one of the greatest things about being a pediatrician is you really do have to explain very complex medical, issues to both the parents and to the 5-year-old. And you have to present that information in a way that both parties can understand. So it's been a joy to be able to be on podcasts like this to educate the masses, and that you don't have to go to medical school to learn it or be overwhelmed by the information you're hearing and seeing on the internet. So plastic is a synthetic chemical. It happens to look like our natural hormones. That's why when people hear the word endocrine disruptors, that means hormone disruptors, the chemicals in plastic look like our natural hormones, but they don't act like it. And why that's important is our hormone system is incredibly important for us to kind of do our daily activities, to grow and to thrive in the proper way. So a lot of people think when they hear endocrine, they think fertility or my thyroid, and they think about adult issues. Well, endocrine system is incredibly important for your child to grow and develop in the proper sequence and the proper timing. So for example, for any parent listening, when your child was in the newborn nursery, they did a series of kind of blood pokes, and one of the things that they did is to make sure their hormones are kind of in that right stage. Because when your child doesn't have enough thyroid hormone, for example, their brain might not develop as well. And so the endocrine system is incredibly important for children's brains to kind of develop, their internal organs to continue to develop, and for them to go through like puberty at the right time and right stage. For their body, when they see a carbohydrate or glucose, that they're able to process it in the right manner. And what's happening is that these chemicals are leaching in from, the foodware, the toys, everything that they're consuming in the food and the drink that they're having. And it's going into our bodies. And it is truly wreaking havoc on what is an otherwise very well-oiled machine called the endocrine system, which is why they're called endocrine disruptors. And so this is particularly important for children because, if you have a kid, they like to, especially when they're young, explore the world with their mouth. So they're putting everything into their mouth, right? So those plastic toys are going in their mouth. We make products for babies that are all plastic, right? And so they are having such exposure for such a prolonged period of time. And then number two, their body surface area compared to me and you is it's so small. So like what they're relatively seeing compared to their size is so much more. And the number three is they are going through critical stages of growth and development. And so our organs are formed. We've kind of done our growing. But these children, they're not born, children are not born fully developed. And we know that from a newborn all the way till if you have a teenager, you know that they're not fully developed, right? And so these changes are happening at critical stages of growth and development. So for those three reasons, they are even more at risk for these endocrine disruptors. There's a lot of the beauty industry has really picked up on this in terms of beauty products and personal care products and fertility, for example. So it's equally important in the adult world.
Yep.
But when we think about hormones and endocrine, we don't typically think about children.
Yeah.
And I'm here to say and give the voice to the children, it's crucial that their hormone system stays intact and undergo at the right time. I mean, we're seeing kids undergo puberty as young as 6.
Wow.
They are starting puberty earlier and earlier.
Yeah.
They're getting type 2 diabetes and their body is actually reacting to the glucose that they see in a different way than they should, And so we call these plastic chemicals obesogens, meaning they're actually changing the way that the fat cells look. And so when we really kind of zoom out and think about that, we should all really care about our hormone system in our children's bodies.
And a quick question, because I've tried to learn about the endocrine system, and great to have an expert right here. When you talk about those plastic, synthetic plastic, is it molecules at the molecular level, or what's the?
That's a great question, because so really what you can think about it, what people need to know about plastic is at the base level, there's 2 parts to it. A lot of people are hearing about microplastics and then the chemicals like bisphenols, phthalates, things of that sort. So how I like
that's like the BPA, BPC, BPS.
That's right. Yeah. That's right. So there's microplastics, which are these kind of like nanoparticles. So it's more of a particle level.
Yeah.
And then
it's a solid.
Exactly. And then you've got plastic chemicals.
Right.
And so they're 2, but they're coming from the same source. They're just different forms of plastic. And when plastic is broken down, it's broken down into both microplastics and into the chemicals that are made to use them in the first place. So both of those things, I think a lot of people hear about the term microplastics and they hear about BPA or bisphenol, phthalates. What you need to know is at the end of the day, it's all plastic. And so they might affect us differently, and research continues to go on. The most research right now is really done at the chemical level, where we know, like Europe just banned bisphenols in their foodware because they said
all of them,
whether
not just BPA.
That's right. So that's a common misconception that I would love to share really quickly, which is BPA-free plastic doesn't mean safe. And
Correct.
All it means is that it doesn't have BPA, but it might have all of the what one of my colleagues calls regrettable substitutes. So whether it's BPS, BPZ, they're really the molecular structure and the family is the same, which is bisphenols. So that's important to note, not to scare people, but to have a better understanding of what this all means and to not feel paralyzed by kind of fear or overwhelm in the decisions you make, but to just understand. So those are the 2 classes of what I think about plastic. So, and then the other one is, oh my gosh, well, I can't live in a plastic-free world. What can I do? And that's really important, because I'm sitting here talking about your children's foodware. You're talking about water. And so food and drink is an important one, because we can ingest these microplastics and these chemicals. So that's one route. But also we can absorb them through our skin, which is why, you can pay attention to the clothing that you're wearing. You can pay attention to the personal care products that you and your family are using.
Yep.
And then the, other sources are like your air.
Yep.
So you can use a HEPA filter. You can open up your windows. So it's not about suddenly feeling so overwhelmed that, you know what, it's everywhere, I can't do anything about it.
Right.
But rather choosing maybe one small thing to change, and then maybe a little bit later, another small thing. And and that's kind of how incrementally we can attack this, from a personal standpoint. So my goal is not to be on podcasts and scare everybody, but rather educate and empower them to make decisions that are right for their family.
That's great. And in the air question that you mentioned, right, also, correct me if I'm wrong, but I would add as much as possible, like having furniture and rugs that are made from natural materials, right? So you can choose like wool rug rather than like some sort of polyester blend, so that you're not like, rubbing your feet against plastic and then having these microfibers, emanating into the air.
That's right. I bring that up so people can understand that it's not just the foodware, and I think you and I are not here just to promote products as founders, but actually we are purpose-driven founders, and we have products that have a mission, and that addresses one part of the plastic problem, but not all of them. So we need people to kind of come together from different parts of life, whether you're a parent or a founder or a business or a policymaker, to say, okay, how do we kind of methodically start to attack this problem of plastic?
Absolutely. And we can, right? We built the system, we can rebuild it.
That's right.
So you talked a little bit about adults and endocrine-disrupting chemicals. What I'd be interested to hear about is, how does choosing different materials, and we were kind of on that conversation, how does choosing different materials impact health outcomes and environmental footprint?
Yes. So number one is, you can't get rid of all of these additives and all of this plastic overnight. So I think just recognizing that. But what we do know is that even in adults, like for example, one condition that we have seen in adults really rising is colon cancer. They're getting younger and younger. And so I've got my GI colleagues really discussing this. And there's a lot of literature about microplastics and its impact. And so in general, cancers, in addition to fertility and other kind of neurologic disorders. So again, it's affecting both children and adults. So it's not to be paralyzed by that information, but rather kind of what can you do? So I always tell people, don't worry about elimination. So don't think about this elimination diet or this elimination lifestyle. Just decrease your exposure. And do what you can in what you are most kind of convicted in. So for example, I started my kitchen because food was such a big part of my upbringing, a big part of kind of how we parented. So our kind of pathway to both sustainability and health started in our kitchen. And that's great, right? So we made small changes from the Tupperware plastic containers to glass, from getting rid of the PFAS laden nonstick pans to really stainless steel, cast iron, and alternative materials. So that for us was where we started our journey. You might be listening, and I've got a good girlfriend. She's in fashion, and so for her, she really started in that realm of materials, of textiles. And so that's how I would kind of encourage people. It's like, whatever you already feel most is important to you, start there and start really small with a change. So it's not about elimination, but rather decrease your exposure, because incrementally it does make a really big impact. And studies have shown when you decrease your exposure to these plastic chemicals, those chemicals in your urine can come down in as little as 5 days. That should feel like hope and not stress and fear, right? That, okay, if I just make these small incremental changes, that can help. And then from a sustainability perspective, are we all going to have electric cars and have zero plastic? Like, that's not realistic. So what can you do in your own impact? I think that in general, even in my own journey, understanding that plastic is related to carbon emissions, that, a lot of the food, like meat, is related to carbon. So again, do you need to be a vegan and never touch a piece of plastic again? No. But could you maybe just decrease your consumption, and for families, have a meatless Monday? You already did your part. That's one small step in the right direction.
It makes a really big difference.
That's right. So that's what I would tell people is you can impact the planet and your own health in these small incremental ways.
Absolutely. And then when you get accustomed to that, if you're ready for the next step, feel free to take it.
That's right. I always say Ahimsa is the gateway. It's the gateway drug to sustainability and health, because we have these beautiful, like rainbow steel plates that are portioned perfectly for children to visually understand, hey, half my plate should be fruits and vegetables. Here's where my whole grains go. Here's where protein goes. And suddenly that becomes this tool and this vehicle for learning, right?
Yeah.
And when you do that in the school system, suddenly you're teaching them about reuse versus single use. So instead of using, a plastic spoon or a tray for 15 minutes and then throwing it away, you're already teaching them sustainability by modeling it, by having them incorporate it into their day-to-day. And what's beautiful about children is they're the best teachers. They will go home. We've got customers who are like, Dr. Mantravadi, my child won't use anything else, just your foodware. And now I must serve multiple things on their plate. I'm like, good, that's great. Because the American diet is typically like chicken nuggets and a french fry. And they're like, now she wants this thing in this portion and this thing.
Yeah.
But that's great. Your child is really getting it and they're the best teachers. Or a child might come home from school and say, hey, maybe we should just reuse these crayons instead of getting more. So even though we're teaching in the cafeteria, they're learning these concepts of reuse and health in a way that they're going back and teaching their parents.
It's awesome. Yeah, it's a great pathway, right?
That's
and then they come home, they're like, but we're reusing.
That's right.
At school, it's easy.
That's right.
Yeah. We have your product at home for our son. It's beautiful. We love them.
Thank you.
Yeah. So we're both using stainless steel. I'd love to hear from your perspective, what makes stainless steel safer and more sustainable? You talked a little bit about both, but dig into that material specifically.
Yes. So scientifically, I actually so we have a scientific council at Ahimsa. I was able to get, honestly, the world's leading experts and innovators and scientists, environmental health, toxicologists, everybody on board, because it was really important to me to understand how to produce a product that was as safe as possible for my own kids, my patients, and millions of children. And one of those scientists and fellow pediatricians is Dr. Leonardo Tresande. He was actually the author of the American Academy of Pediatrics food policy statement that completely changed my life in terms of what I was doing.
Amazing.
And I asked him, I said, Leo, why did you only cite glass and stainless steel? These were the two materials in the policy statement that said, we know plastic is harmful. Try to avoid it. If you have to use it, don't put it in the microwave. Don't use it when it's etched or scratched. Use certain types. But we prefer to use glass or stainless steel. And I asked him, why did you choose these materials?
Yeah.
And it really has to do with the body of research and the longevity of that research. So we've been using glass and steel for a long time.
Yeah.
So it's been studied in terms of health impact and environmental impact kind of ad nauseum.
Yeah.
So number one, it's just these are trusted sources of materials that have just been around for a long time.
Yep.
Obviously, steel doesn't break. Especially for kids, it's an important distinction. But what people need to know is the word called inert, right?
Yep.
So stainless steel is inert, meaning if you expose it to heat, if you expose it to acid and food, it doesn't leach out the chemicals that make up steel into the food and drink.
It doesn't break down those molecules.
That's
like
right.
the molecules you were talking about before with the plastics.
That's right. And so people might hear the term, oh, it leaches into your food or it migrates into your food. So, I'm a scientist first. So when I design the products and continue to monitor our safety, we do migration studies. Those are not mandated, by the way, here in the United States by the FDA. You don't have to have migration studies. So everything that we do is per the European Union and some of the most rigorous testing around the world. That's what we use at Ahimsa because it's really important to me to make sure that anything that I'm putting on your family dining table or school lunch is the safest that I know how to do.
Yeah.
And so that migration, you won't see migration of, the iron that makes stainless steel. And as opposed to plastic, when you expose that at baseline, those chemicals, the bisphenols, the phthalates, all of these chemicals are migrating or are leaching into the food and drink. When you expose it to heat, when you expose it to that etched and scratched, everyone can remember those etched and scratched, school trays or your Tupperware that used to be there. Everyone has that like, ooh, it's probably not great, but I'll still use it.
Yeah.
Don't use it because your gut is correct. Those are kind of migrating. That's why you see steel in hospitals,
Right.
right? That's why a lot of our implants are made of, steel, our surgical instruments.
Yep.
If you go to commercial cafeterias and commercial, chefs and their kitchens, it's all steel.
Yep.
There's a reason. So inert is one reason. Number two is that it's so like antimicrobial. It's just so easy to clean.
Yep.
And so it's non-porous. So
Yep.
it doesn't have that same, all that junk, all that soap, all that extra food that your child didn't eat gets stuck in those pores.
Yeah.
For steel, it's non-porous, so it just kind of wipes right off. So
Yeah.
again, another reason you really see it in the commercial dining space and in hospitals. So when we start to think about, you're like, oh, well, yeah, duh, we've been using it for a long time. Hospitals use it, professional chefs use it. It makes sense on why we should probably prioritize steel in the consumer world.
Yeah, 100%. Yeah, very convincing. It's also, again, I'm not a scientist, but when you think about plastic, right, it was designed to be light and flexible.
Mm-hmm.
And so if you start to take that information a step further and you think about what are those molecular bonds, it's designed so that like if you grab a plastic bottle of water and you squeeze it, right? Like, yeah, it kind of changes shape and that's good for your hand.
Yep.
But that means that those molecules are kind of like your hair, like they're
kind of
bending
moving around,
and
yeah.
folding and cracking.
Yep.
And that in my mind, at least, that's how I
Yes.
explain it to myself, right? Is that's when those molecules are kind of like getting broken apart and migrating into, let's say, your water
Yes.
or your food.
That's right. That's right. And it's not just, we were talking about kind of, the longevity of the research, the migration, things of that sort, but also from a sustainability perspective. I think even when I first started, I didn't realize the full life cycle of plastic, right? From production
Yeah.
to use to disposal.
Yep.
That life cycle of plastic is horrendous for carbon emissions, like horrendous. And steel, so everything that we use at Ahimsa is recycled steel, clean recycled steel. And why that's important is steel is infinitely recyclable.
Yep.
And so when you're not sourcing new steel and when you're able to use it for a long period of time, and if you have to recycle it, it's easily recycled, as opposed to plastic where it takes so much kind of petroleum to even make it in the first place and so much in terms of carbon emission byproducts in this entire life cycle.
Yeah.
Because it's cheaper to just make new plastic than to recycle it. So less than 8% of the world's plastic is actually recycled. So when you even think through not just health, but what we're doing to our planet,
Yep.
it's a really big impact. And I think I want people to understand that it might not be a big deal to you, right? Not everyone can. Sustainability is long-term. It's abstract. And not everyone can get behind it. And I get it, right? That's like human tendency. But when I talk about health of children, it's real.
Yep.
It's in front of you. It's your child.
Yep.
And what I would say is if you don't care, like we care about like everyone cares about the planet, but if you're not so convinced about it, then turn to your kid and look at them and understand that this is the planet we're leaving behind for them.
Yeah.
So even though it might not feel immediate, it will impact your child and by no doing of their own. And so I think that's another important reason to be really mindful in the choices that you're making on your everyday, because they do count. When billions of people make small changes, man, it's a really significant impact on our planet and health.
Huge. Absolutely. So tell us about the Conscious Cafeteria Project and your work with the Clinton Global Initiative.
Sure. So when I first started Ahimsa, it was a consumer product because I realized that, again, science was saying something, but industry wasn't really offering parents the solution that their pediatricians would now have to recommend. And so we started in the consumer space because I wanted to transform kind of family dining tables across the country. And then I had lunch at my child's school one day. And, I realized very quickly that they were eating off of at least reusables. So they were using reusable plastic trays, which is a step up from disposables. But I saw them, they were etched and scratched. And I thought, oh my gosh, here I am trying to change one by one parents. And that's great. But what about these millions of children who are eating lunch at school? And that's when I had the aha moment of the biggest way to change the trajectory of this country for our children is through school lunch, because there are 30 million children enrolled in the National School Lunch Program, eating 180 days out of the year. Many of them, it might only be the only meal that they receive.
Yeah.
And for the ones who are eating, more than 50% of the calories that they consume are happening at school. So it was, how do we now empower the schools to be more conscious about the materials that they were using, about the foods that they were serving, about the nutrition education that they were kind of imparting on these very young minds who are clearly capable of learning about health and sustainability when it's tangible. So the Conscious Cafeteria is really a program that combines both, going from disposables to reusables, reusable steel, along with education. Because again, kids are the smartest, coolest, kindest, most innovative humans on the planet, which is why I went into pediatrics. And so when you can go into the school setting and make that cafeteria more conscious, it's great. So we're in hundreds of schools, many districts across the country. But what we did through the Clinton Global Initiative is to study 15 of those schools. Okay. We studied 15 schools who were otherwise using disposable foodware and converted them to reusable Ahimsa steel. And the results were insane. Every school saved money in that first year.
Wow.
Every school decreased their carbon emissions by over 80%.
Wow.
They decreased their water usage and how much wastage was going into landfills.
Wow.
And every student really was learning about these concepts. And, this is not some innovative new vaccine or technology, or all we're doing is this simple, scalable solution of reuse and kind of slowing down and teaching people that food is health. And the results are significant.
Wow.
They are lasting, and they can change the trajectory of both carbon emissions and landfill, but also this really epidemic rise of chronic conditions in children.
So exciting. Congratulations.
Thank you. It is exciting. It's simple. It's like, it's not rocket science. This literally is not rocket science.
Yeah. But it's available. It's ready to go.
That's right.
Yeah. So we heard some amazing things about what Ahimsa is accomplishing. As an entrepreneur myself, I understand that for every high, there's a low. What challenges did you or are you facing to bring Ahimsa to life? And how do you push through?
So if I knew about entrepreneurship before I started, I think every entrepreneur would say this, you'd highly reconsider. Be like, oh, is this a great idea? Or is it a really long process? And I would say that to any entrepreneur listening, if you're going to enter entrepreneurship, just really be passionate about your why. Yeah. Because of the highs and the lows are really low and the highs are really high. As a first-time entrepreneur, just really learning through kind of the finance and the cash and like what it takes to even just run a business was really eye-opening, right? Because in order to grow, you need more. In order to get to more schools, you need more, money to create more products for schools to have. And so just that process of growth, scale, and what it takes to actually grow an idea was a big learning. For me, it's not just, you see all these success stories and you see Shark Tank and you see, it's like, oh, overnight. It's not overnight. Like for anyone listening, I think you can attest to that too. It's definitely not. No. There are many nights, sleepless nights, but it's not overnight. So I think I definitely did not anticipate all of the challenges that were actually beyond my control. So for example, global pandemic and our entire supply chain. Yeah. I launched Ahimsa January 2020. And then obviously the pandemic happened in March. I think probably one of my most trying times of my entire life was being a frontline worker on the COVID unit in our children's hospital. Wow. My kids at home doing remote learning and trying to fulfill orders from a company I had no idea on even how to run, but people were ordering and I didn't know how to get it. But then protecting our workers in India too, because I didn't want them to. So that was probably one of the most trying parts. And that is a repetitive theme, which is, as a founder, there are many things you can control. There are many things you cannot. So whether it is now steel tariffs, right, whether it is kind of funding for schools to really focus in on fresh organic products for their school.
Right.
So whether it's policy, economy, consumer behavior, like you can't control those things.
Right.
And so being okay with, just like in life, knowing what you can change, knowing what you can't change, really recognizing which one of those you're facing, and then how to kind of deal with it. I think that's one of my biggest learnings, that I'm such a control freak. I'm a female, I'm a mom, I'm a doctor.
Yeah.
I really like to control everything. And in this world of entrepreneurship, you can't. But what you can do is be resilient and to have a why, because that's what gets you through. And I will say, being a doctor, the worst thing that happens on my shift is truly like a child dies. That is the worst possible outcome. And so taking that into entrepreneurship,
right,
it really helps me kind of reframe like, hey, the worst thing that can happen is, yes, a global pandemic and a supply chain, but everyone is okay at the moment. And so reshaping kind of just some of that thinking that don't sweat the small stuff, it's all small stuff.
Yep.
I think being a doctor has really helped me in entrepreneurship.
Yeah, of course. I imagine you've already been through incredibly rigorous, tough times that tested your resilience. So
yes.
You kind of have built that muscle.
That's right. I'm actually getting together with my residency girlfriends. And I will tell you, being a resident, that is a talk about resilience and tough time, and really not just the hours you work, but what you face in terms of these families and what they're undergoing, and taking that on emotionally and physically when you're working 30-something hours. and so, yeah, I really do hope that more physicians will go into entrepreneurship, because I think that we really see the world in a very special way, talking to patients from all walks of life in their most vulnerable points of their life.
Yeah.
It gives you such insight into the pain points of humanity.
Yeah.
And because we're such fast learners and we're really dedicated, you can come up with really great solutions for your patients, whether that's in medicine or outside of medicine. And I hope more physicians will think about it, because it's an honor to be a physician. And I think that if we can flex our kind of muscles in different ways, we can really impact the world even outside the hospital walls.
I love that. I'm so inspired. I hope everyone out there is as well. You've talked a little bit about this, but wanted to dive in on how does Ahimsa navigate systems change while still growing as a business?
Yes, I've been very blessed with wonderful people around me, from my investors to my advisors to now my president. I think really honing in and getting a good team around you as a founder is critical, especially if it's the first time you're doing it, because they can really help you understand these systems and how to navigate. Now, listen, we're navigating in territories that, my president and my investors have not seen before, which is tariffs, and which is trying to figure out manufacturing in a different way. And so I think navigating those systems, again, kind of comes back to understanding what you can change, what you can't change, what you're going to be principled in, and where you can kind of pivot.
Yeah.
I think that, to me, like, so for example, I feel like we've made it because we have copycats now. And I heard that if you have a good idea and it's copied, that you've made it. I don't think my business advisors love that we have copycats. However, what I will say is I will be principled. So our problem is that now we've got, people who are copying our product. But the solution is not to just slash everything that we're doing,
right,
and compete with these prices, let's say on an Amazon, right? Because that's not what I did this for. I did this for the safety and health of children. So in this aspect of systems changes, there is some systems changes in terms of our competitive landscape, for example.
Yeah.
I'm going to be very principled in I'm not changing the way that we treat our workers in India.
Yeah.
I'm not changing the way that we test all of our products. Yeah. I'm not changing our quality and safety. Like, I won't do it. It means my product is inherently more expensive than other products.
Yeah.
But I won't change that. Now, there are other things that we can do, right? To say, okay, we're going to be really, really critical over here. But when it comes to schools, what can we do? And in this aspect, it's like, I'm not going to change the quality and safety. However, let's decrease our margins, because you know why? It's super important to the masses of children.
Yeah.
And so like, that's where I think in terms of systems, like thinking through, you might actually have the exact same problem. But if you have different business units or different environments in which you're working, you can start to make decisions that still feel good to you as a founder.
Yep.
But at the end of the day, the health of your business matters. I think that's one thing that I really had to wrap my brain about as a physician entrepreneur. I felt icky. I really felt icky selling people products.
Yeah.
Because that's not, like, I'm there to take care of your health. And yes, I get paid to do it. But it's not this transactional thing in physicians, right? But when you come to my website, it's a transaction. And it felt weird to me as a doctor. But then once I really understand that if Ahimsa is healthy, if Ahimsa is successful, it means the masses of children are being impacted in a positive way.
Yep.
And that's when I really wrapped my brain around, nope, I got to get my businesswoman hat on.
Yep.
And I'm not selling out on medicine, but I am being really smart about keeping my business healthy and making these decisions within these systems.
Yep.
Is quite honestly what I do when I have a really sick patient in front of me and have to make some fast decisions about their blood pressure or their heart rate.
Yep.
Like, I have to take a lot of information really quickly, assess the environment that we're in and the decisions, and make the best thing for that health of that child. Same goes for being a CEO, right? That's kind of what you have to do. And so that's what I would tell people is just don't sacrifice what you believe in, but be willing to understand where you need to maybe change, where you need to be pivoting, listening to people who have a lot of experience in this and not feeling like you know what's best for your company at all times. Because you probably don't, especially if you've never done it before.
Yeah, I love that. Just I can imagine and viscerally understand the analogy you were making between being a doctor and then being a business person. And, you know, that the business is the means by which you are going to enable so many children to grow up healthy.
That's right. That's right. I used to hate the term CEO. I was like, no, I don't want to be CEO. And one of my advisors said, yeah, but you kind of are because you started a business. I was like, but I don't like it. And I'm like, well, you chose it, so you have to wear this hat. And I think as I've grown into that role, really recognizing that, no, this is, you know, there's a lot of people at the table as CEOs in really big positions, making really big social impact that I don't agree with, right? And so this is my way of saying, oh, well, if I'm at the table and I can kind of, you know, bend the arc towards children's health, well, why not? Because if not me, then them, right? So why not sit at the table and advocate for a bunch of children who don't otherwise have that voice at that table?
Absolutely. I love that. So you've started teasing this, but what's your big vision for the future of Ahimsa?
Oh, change the whole world, right? We've always talked about, we're like steel, it's going to change the whole world. So for me, Ahimsa is truly a public health mission. We just happen to serve that public health mission on beautiful quality stainless steel. Yeah. And people are listening. And so I'm like, oh, well, while I have you, let me also talk about the food that's on that plate, about the sustainability that is in this plate. And so my big vision for Ahimsa is that it does become a household name. I do want, if steel hits that dining table, at that school lunch table, I want people to just call it Ahimsa, like Kleenex or like Nutella, right?
Yeah.
Or Tupperware. And everything that is steel, like I would love for that beautiful word from India. Ahimsa is a Sanskrit word meaning avoiding harm. It's the first oath I took as a doctor. Wow. Certainly as moms, it's the first oath that we take as, you know, mothers, and certainly an oath that I take as a human towards my planet. And so if I would love Ahimsa to be a household name for all things steel at the dining table. But more importantly, what I want it to do is to change behavior, to change policy, because that's why I did it. I didn't do it to just design a product and to sell a bunch of plates. That was never my intention. It was always the sneaky way of doing preventative pediatrics. So that's my goal.
I love that. It's so exciting. And I think one aspect that you are alluding to that I know we at Kadeya aspire to is the idea that you can do the thing that is better for you and better for the planet. And it can also be beautiful and fun and convenient and high quality, that you don't have to sacrifice those things.
Yes. And yes, because health doesn't have to mean boring. Like the broccoli that you serve, if it's soggy in the school lunch line, they're not going to eat it. But if it's a broccoli crunch salad in this beautiful Ahimsa bowl, kids feel fancy and they feel value to that food and they eat it. And people are like, oh my God, they're eating this. I'm like, I know, right? Like it doesn't, health does not mean, health and responsibility and sustainability doesn't have to mean, nerdy and boring, although nerdy is pretty awesome in my opinion.
I agree. Hear, hear. Okay, from that, we're going to switch over to rapid fire questions. Okay. So what's your go-to mantra when the founder journey gets tough?
Oh, I'll go back to what I said earlier. My mantra is truly, don't sweat the small stuff.
Yeah.
It's all small stuff.
Yeah.
It's all small stuff. It might not feel like that in that moment, but don't sweat the small stuff. It's all small stuff. And I am capable.
Yeah.
You can just repeat that to yourself.
Yep.
You might be able to sleep maybe an extra hour.
Yeah. Which is very important.
Yes.
As a parent and as an entrepreneur, but what's one parenting myth you wish we could all unlearn?
Oh, this one's easy. I think every parent feels like, oh, I screwed it up. Oh, I screwed it up. The number of people who, once they hear about Ahimsa, they're like, oh, my kid's a teenager, like I've screwed them up. Or, oh, my kid is only eating chicken nuggets, I've screwed it up. Don't blame yourself. This is a journey. Like no one has a manual.
Yeah.
And I tell new moms this all the time when they're trying to breastfeed. They didn't come out with a manual on, you don't like have your child and they also bring out in utero, here's the manual for how to raise me well. Like it's okay. If only, right? That'd be the $1 trillion idea. But I think that's the myth is I screwed it up. Just take that out of your mind.
Yeah.
And if you feel like you can make better choices moving forward because you have now been educated and empowered to do so, then do it. And don't look back. It's okay. Like your kids are resilient. They're going to love you no matter what. And honestly, almost all kids, they're going to be just fine.
Yeah.
You just love them. Yes.
I'm taking that home with me.
Yes.
Speaking of journeys, what's something you believed at the start of the Ahimsa journey that has totally changed?
Oh, I thought I'd be able to start this company, scale it so quickly, and then be like, on a beach somewhere being like, oh, look at all the children who are healthy.
Yeah.
Turns out that's not how startup worlds go.
Yeah.
And I think it's just because in medicine, you have a very very specific 4 years of med school, 4 years of residency, all of this. And in entrepreneurship, it's so up and down, you don't know.
Yeah.
So that is a reality check. It's not necessarily surprising. It was a reality check as a first-time founder that whatever you think it's going to take, it's going to be more expensive, longer, and way more trying than you ever imagined.
Yes. But it's good that you were naive. Otherwise, we wouldn't have Ahimsa.
That's true. That's true. Had I known, doctors are pretty risk averse. So I don't know if I would have done it.
Okay. I love that. Okay, finish the sentence. Sustainability starts with
knowledge.
I love that.
Yes, because I think knowledge truly is power. So knowledge is power about sustainability, about health. And if you don't know, you don't know. And that's okay. But now you do know. And so when you know, how can you make small changes? And so I think that's what I educate all of my patients and our consumers is just learn and try something small.
Totally.
And that's okay. And you've already hit the jackpot. You've hit the jackpot.
Yeah, absolutely. Okay. And to finish us off, where can everyone follow you on social media and purchase Ahimsa?
Yes. So you can go to at Ahimsa Home USA on our social media. And you can buy products directly at ahimsahome.com. We have a wonderful content platform called the Pediatrician Kitchen,
okay.
Where we not only, we sell products, but then help parents really deliver healthy food, recipes, hacks on time, cost, and skills around cooking in the kitchen. And then you can also go to ahimsaschools.com. If you're a school or if you're a parent in the school-age children, you can go to ahimsaschools.com and learn more about our products and our conscious cafeteria.
Thanks, everyone, for joining us today to hear from Dr. Manasa Mantravadi, our board-certified pediatrician guest, public health advocate, and the founder and CEO of Ahimsa, the world's first colorful stainless steel dinnerware company for kids. Thank you to Manasa for coming today, and please join us for future conversations here on Unbottled. Thanks for listening to Unbottled. If this episode got you thinking about plastic, systems change, or how we build a better future, don't just be a listener, be an owner. Kadeya is raising a community round on WeFunder, and that means you can invest as little as $100 and help us bring closed-loop beverage systems to more people in more places. Because real change doesn't happen alone, and the future of hydration needs all of us. Learn more and join our investor community at wefunder.com/Kadeya. That's Kadeya. The link is also in the show notes. Let's build it together.